Hello and welcome to Crack the Boards. In today's video, we will focus on USMLE questions related to physiology. Let's have a look at the first question. A team of mountain climbers embarked on an expedition to a high-altitude mountain in Nepal. Before the journey, they underwent training at an elevation of 18,000 feet. On the second day at this altitude, two climbers began experiencing symptoms such as lightheadedness and nausea. They were also noted to have headaches, muscle weakness, and shortness of breath. Both climbers exhibited elevated blood pressure and heart rates. Which of the following options best identifies the physiological stressor and the corresponding response in these individuals? A. High ambient temperature and increased pulmonary arterial blood pressure. B. Low ambient temperature and reduced adrenal steroid secretion. C. Low barometric pressure and reduced alveolar ventilation. D. Low inspired carbon dioxide and metabolic alkalosis. E. Low inspired oxygen and sympathetic nervous system activation. The correct answer is E. Hypoxia occurs at high altitude due to low inspired oxygen levels. The significant stress of this hypoxia activates the sympathetic nervous system, leading to symptoms including lightheadedness, muscle weakness, dyspnea, and headache. Let's have a look at why the other options are incorrect. Option A is incorrect as high ambient temperature occurs more commonly at lower altitudes and is unlikely to be the cause of this patient's symptoms. Answer B is incorrect as ambient temperature is low at high altitude, causing increased sympathetic nervous system activation. This leads to increased, not decreased, secretion of adrenal stress hormones such as cortisol. Option C is incorrect as barometric pressure is reduced at high altitude, but there are no direct sensors of low ambient pressure to link to this physiologic responses. Alveolar ventilation would be increased, not decreased, at higher altitudes due to reflexive hyperventilation in response to low inspired oxygen levels. Option D is incorrect because inspired carbon dioxide is virtually zero even at sea level. At high altitude, the low inspired oxygen results in hyperventilation and alkalosis of a respiratory, not metabolic origin. Let's have a look at the second question. A 15-year-old boy, tall and obese, presents with bilateral gynecomastia, reduced testicular volume for his age, and sparse axillary and pubic hair. An MRI of the pituitary gland is normal. A buccal smear reveals a single bar body and chromosome study results are pending. Which laboratory findings are most consistent with this patient's condition? A. Elevated serum FSH and elevated serum LH and low serum testosterone. B. elevated serum FSH, normal LH, and normal testosterone? C. Low FSH, low LH, and low testosterone? D. Normal FSH, elevated LH, and low serum testosterone? E. Normal FSH, normal LH, and normal testosterone. The correct answer is A. Elevated serum FSH, elevated serum LH, and low serum testosterone. This is because this patient likely has Klinefelter syndrome, which is a sex chromosome disorder. These individuals have one bar body due to the random inactivation of one X chromosome. Typically diagnosed in adolescence, patients show characteristics like long limbs, small testes, sparse hair, and gynecomastia. Testicular dysgenesis reduces inhibin production, leading to elevated FSH levels, and the increased FSH stimulates aromatase, causing excess conversion of testosterone to estradiol. This results in hyperestrogenism and hypogonadism with low testosterone and increased LH level. Let's have a look at why the other options are incorrect. Option B is incorrect because elevated FSH, normal LH, and normal testosterone are consistent with pure seminiferous tubule failure, which is most commonly caused by a varicocele involving the left testicular vein. Option C is incorrect as low FSH, low LH, and low testosterone are consistent with hypopituitarism in which the FSH and LH are decreased. A low LH causes a decrease in the testosterone synthesis. In this patient, the MRI scan of the sella turcica is normal, which excludes hypopituitarism due to a non-functioning adenoma or craniopharyngioma. Option D is incorrect as a normal FSH, elevated serum LH, and low serum testosterone is consistent with a pure Leydig cell failure. Option E is incorrect as a normal serum FSH, LH, and testosterone would not be expected in a patient with hypogonadism at puberty. Let's have a look at the third question. A 60-year-old man presents with shortness of breath during short walks on flat ground. He has a history of smoking 1 pack of cigarettes daily for 30 years, along with moderate obesity and hypertension. On examination, he has central cyanosis and digital clubbing. His breathing is slow, with deep tidal breath, and he exhales through pursed lips. Wheezing is audible during expiration. What findings are most likely to be observed in further cardiopulmonary investigations? A. Deficiency of alpha-1 antitrypsin. B. Increased forced expired volume in 1 second. C. increased hematocrit, D, low arterial carbon dioxide tension, E, low total lung capacity. The correct answer is C, increased hematocrit. Chronic hypoxemia can cause secondary polycythemia from renal secretion of erythropoietin to stimulate erythropoiesis in the bone marrow. The increased red cell mass compensates for low oxygen content by increasing the oxygen carrying capacity. Let's have a look at why the other options are incorrect. Option A is incorrect because while alpha 1 antitrypsin deficiency accelerates the progression of COPD, it typically manifests in smokers before 45 years of age. Option B is incorrect as the patient most likely has COPD and is thus expected to have a low forced expired volume in 1 second on pulmonary function testing. Option D is incorrect as this patient has COPD, which is associated with dead space ventilation and hypercapnia from carbon dioxide retention. Option E is incorrect as the lungs in COPD tend to have a higher total lung capacity due to increased lung compliance. Despite these volume changes, the number of alveoli is reduced. There is more dead space and less capacity for gas exchange. This concludes today's set of questions. Thank you for watching today's video. If you enjoyed it, please don't forget to subscribe to the channel to stay updated on our latest content and support our journey.